Welcome to A to Z Nursing Vlogs. This video is about the applied anatomy of the fetal skull. Let's dive into the video. The fetal skull is to some extent compressible and made mainly of thin pliable tabular bones forming the vault. This is anchored to the rigid and incompressible bones at the base of the skull. The skull is arbitrarily divided into several zones of obstetrical importance. These are the vertex, brow, face, and the sinciput. Let us see diagrammatically. The facial skeleton of the term fetus. The facial skeleton of the term fetus is relatively small. In the adults, the facial skeleton forms one-third of the skull, but in the newborn, the facial skeleton only forms one-eighth of the skull. The smallness of this is due to the rudimentary development of the maxilla, mandible, and the paranasal sinuses, absence of the erupted teeth, and also due to the small size of the nasal cavities. The nose lies almost entirely between the orbits, and the orbits appear relatively large. The sutures. The sutures are the fibrous joints between the flat bones of the calvaria. Sutures allow the bones to move during the birth processes. Sutures allow brain to enlarge during the infancy and childhood. The sutures. The important sutures are the metopic or the frontal sutures, sagittal sutures, coronal sutures, lambdoidal suture, squamous suture, intermaxillary suture, and the intermandibular sutures. The sagittal or the longitudinal suture, as shown in the diagram, lies between the two parietal bones. The coronal sutures run between the parietal and the frontal bones on either side. The frontal suture lies between the two frontal bones. The lambdoidal suture separates the occipital bone and the two parietal bones. The closure of the sutures. The cranial suture starts to ossify by the age of 8. Sutures on the facial skeleton ossify earlier. For example, the metopic sutures closes as early as 3 months of age, normally between 3 to 9 months. And the obliteration, which is the union of bones of cranial sutures, progresses with the age, usually starting between 20 to 30 years, often before the age of 40. The obliteration usually begins in the coronal suture and then extends into sagittal and lambdoidal sutures. Craniosynostosis is a condition where there is a premature fusion of the cranial sutures takes place by ossification. This premature sutural closure changes the growth pattern of the skull. Because the skull cannot expand perpendicular to the fused suture, it compensates by growing more in other direction perpendicular to the open sutures. The resulting growth patterns provides the necessary space for the growing brain, but results in an abnormal head shape and sometimes abnormal facial features. In cases in which the compensation does not effectively provide enough space for the growing brain, craniosynostosis results in increased intracranial pressure, which is again a dangerous condition. The types of craniosynostosis. Scaphocephaly, which is a boat-shaped head, it occurs due to the premature closure of the sagittal suture. Brachycephaly, it's a short head, occurs due to the premature closure of the coronal suture on both sides bilaterally. Number 3, plagiocephaly, it's an asymmetrical head which occurs due to the unilateral closure of the coronal suture or the lambdoidal suture. Number 4, trigonocephaly, it's a triangular head. It is occurred due to the premature closure of the metopic sutures. Number 5, pansynostosis, occurred due to the premature closure of the multiple sutures. The fontanelles. Fontanelles are the areas of fibrous tissue membrane separating the bones of the calvaria. As seen in the diagram, the major fontanelles are the anterior fontanelles, posterior fontanelles, anterolateral fontanelles, posterolateral fontanelles. The anterior fontanelles are diamond or rhomboid in shape, located at the junction of the sagittal, coronal and frontal sutures, the future site of the bregma, and it is closed by 18 months of age. The posterior fontanelles are triangular in shape, located at the junction of the lambdoidal and sagittal sutures. The future site of lambda begins to close during the first 2 2 to 3 months after the birth. The clinical use of fontanelles are: it helps during the vaginal examination to indicate in which direction the occiput is pointing, to know the degree of flexion or extension of the head, to know the degree of hydration, to determine the level of intracranial pressure, to obtain blood sample from underlying superior sagittal sinus, to know the progress of the growth of the frontal and the parietal bones. The important diameters of the fetal skull are the anterior-posterior diameter and the transverse diameter. To begin with the anterior-posterior diameters, the suboccipitobregmatic, which measures 9.5 centimeters, extends from the nape of the neck to the center of the bregma. The attitude of the head is usually complete flexion with a vertex presentation. The suboccipitofrontal, which measures 10 centimeters, extends from the nape of the neck to the anterior end of the anterior fontanelle or the center of the sinciput, is usually incomplete flexion in its attitude with a vertex presentation. The occipitofrontal, measuring 11.5 centimeters in its diameter, extends from the occipital eminence to the root of the nose, which is the glabella, with the attitude of marked deflection and vertex presentation. The mentovertical diameter, which is the highest diameter measuring 14 centimeters, extends from the midpoint of the chin to the highest point on the sagittal suture, has an attitude of partial extension with a brow presentation. The submentovertical diameter, measuring 11.5 centimeters, extends from the junction of the floor of the mouth and the neck to the highest point on the sagittal suture, has an attitude of incomplete extension with the face presentation. These are the important diameters of the fetal skull in the case of anterior-posterior diameters. The important transverse diameters are the biparietal diameter, measuring 9.5 centimeters, which extends between the two parietal eminences. Whatever may be the position of the head, this diameter nearly always engages. The suprasubparietal diameter, measuring 8.5 centimeters, extends from the point placed below one parietal eminence to a point placed above the other parietal eminences of the opposite side. The bitemporal diameter, measuring 8 centimeters, is the distance between the antero-inferior ends of the coronal suture. The bimastoid diameter, measuring 7.5 centimeters, is the distance between the tips of the mastoid processes. This diameter is incompressible and it is impossible to reduce the length of the bimastoid diameter by obstetrical operation. The molding of the fetal skull is the adaptation of the fetal head to the pelvic cavity during the birth. It is important to reduce the head circumference. During the passage through the birth canal, the head can be squeezed because of slight movement at the fontanelle and sutures, and slight overriding of bones also occur. Frontal bones slip under the parietal bones override each other, occipital bones slip under the parietal bones. The resilience of the bones of the fetal skull allows it to resist forces that would produce a fracture in adults. If the contents of this video are informative, like the video, share the video with your friends and colleagues, subscribe the channel for more videos. Thank you.